Includes questions in that statement. Thank the Cabinet Secretary and members. We've got everybody in +1, so that's good going. The next item of business is a statement by Marie Goujon on Scotland's testing strategy update. The Minister will take questions at the end of her statement, so there should be no interventions and interruptions. And I call on Marie Goujon. Minister, please.
Presiding Officer, since the Cabinet Secretary for Health last updated Parliament in November, we have made significant progress in rolling out our testing strategy and programme. That strategy that was published in August last year centred on 5 rationales for our priorities for testing for COVID-19 in Scotland. Testing to diagnose anyone with symptoms of COVID-19, testing for clinical care of patients, testing to protect those vulnerable to the most harm from COVID-19, testing to proactively case find among people without symptoms, and testing for surveillance to monitor prevalence and understand disease transmission. Now, I will say more about progress on each of these rationales in a moment, but a key aim for the strategy was to increase daily PCR capacity in Scotland to at least 65,000 by winter last year. That has been achieved. Since the beginning of December last year, our focus has been on expanding coverage of our testing programme and available testing capacity in Scotland into areas where we believe it can have the greatest impact as part of our response to the pandemic. This has been aided by the availability of new types of testing technology, including the use of rapid result lateral flow tests, allowing us to significantly expand coverage for people with symptoms and for those without. Under Test to Care, we have now extended testing to all hospital admissions, to emergency departments, acute assessment centres, maternity units, emergency mental health units, and to all medical and surgical elective admissions. As part of Test to Protect, all healthcare workers in patient-facing roles in our hospitals, in the Scottish Ambulance Service, in COVID assessment centres in the community, and the healthcare professionals who visit care homes and staff working in hospices are now offered twice-weekly testing. The extension of testing to our primary care workforce, including our GPs, dentists, optometrists, pharmacists and pharmacy technicians, is also well underway and on track to be completed by the end of this month. And I can announce today that we will now implement testing for all remaining healthcare workers, including those in non-patient facing roles, providing access to regular testing for more than 170,000 people that the NHS Scotland employs. We've also extended testing in social care, offering testing for up to 2 designated visitors a week for our 42,000 care home residents across Scotland. We have supplemented existing PCR testing for care home staff to provide additional lateral flow testing, and we have completed, a month ahead of schedule, the rollout of testing to the care-at-home workforce, who are critical to supporting and caring for people so that they can continue to live as independently as possible in their own home. Proactive case finding remains a key part of our response to the pandemic. Since the 18th of February, all close contacts of index cases can book a PCR test between days 3 and 5 of exposure to a confirmed positive case. At a community level, Test to Find is a core part of the rationale for targeted community testing, with proposals developed with local partners to address problems of stubbornly high transmission, rapidly rising transmission, or specific transmission risks in local communities. I can advise Parliament that proposals for targeted community testing have now been agreed with 20 local authorities across 8 health board areas, and we have 28 asymptomatic test sites and 12 mobile testing units, providing access to community testing, with more sites planned to open shortly. As well as continuing to offer campus testing to students at times of large population movement, we have now extended access to PCR testing to students prior to travelling to accommodation at university or college. Plans are also being developed to roll out regular testing for university and college students and staff. To manage the risk of the importation of the virus from abroad, quarantine testing was introduced for people arriving in Scotland from outside the common travel area from the 15th of February. All are tested twice during their quarantine period, on day 2 and day 8 of the 10-day quarantine, with all day 2 positive test results being sent for sequencing in order to detect any possible variants of concern. The most recent expansion, announced in February, extended routine testing to support the maintenance of essential services, mitigate wider social and economic harms, and crucially, provide an additional protective layer to support the easing of restrictions for key groups and sectors. To support the safe return of schools, we've introduced twice-weekly at-home testing for all staff in primary, secondary and special schools, and to all secondary school pupils, with the S1 to S3 cohort due to commence testing after the Easter break. Staff in school-based early learning and childcare settings can also receive testing as part of this offer. And, Presiding Officer, I can announce today that from the end of this month, access to testing will be extended to all standalone facilities in the public, private and third sectors, providing early learning and school-age childcare services. Further rollout of regular asymptomatic testing is also now available to food production and distribution businesses, whose workplaces, by their very nature, can present a higher risk of transmission due to factors like low temperatures, high humidity and limited ventilation. We now have over 60 businesses now registered with the scheme and undergoing the relevant training and induction processes. In the public sector, to support the continued safe running of essential services, we have also now implemented regular testing in the control rooms of the Scottish Ambulance Service, Police Scotland, Scottish Fire and Rescue Service and NHS 24 call centres. In the early part of this year, we've seen the emergence of new, more transmissible variants of COVID and also of outbreaks in closed settings. To help address these, we therefore plan to introduce testing of staff working in prisons to reduce the risk of asymptomatic prison staff importing COVID into the prison environment. This will start with 3 prisons to assess the operational feasibility and the public health impact of this type of testing. Presiding Officer, we have made rapid and significant progress across all 5 priority areas for testing, and it's therefore appropriate that we now publish an updated and refreshed strategy. The fundamental purpose to our strategy and testing programme will not change. Testing on its own is not a panacea. It doesn't stop transmission in and of itself. It gives us information to help us take action to stop that spread, to enable us to take the right decisions at the right time. That purpose will become even more important as we determine how best to integrate and deploy our testing strategy and programme to support the safe easing out of lockdown restrictions in the next phase of the pandemic. The activity that I've just set out will continue. We will continue to test to diagnose people who are ill, so if it is COVID, they isolate to stop that spread. We will test for the clinical care of people in hospitals and to protect those most vulnerable to the worst harm. We will keep testing to find cases where we're most likely to find them, whether the person has symptoms or not. We will test to support our essential services, the people who work in them, and to mitigate the wider social and economic harms caused by this pandemic. We will also continue to test to monitor prevalence, which is crucial to safeguarding the progress we've made through all our efforts to do the right thing and adhere to the protective measures in place, and through the success of our vaccination programme. We know the next phase, as we hope transmission continues to reduce, will mean a return to more sporadic outbreaks, and there will be the continuing risk of importing new variants that could undermine our progress. Whole genome sequencing improves our ability to address both of these threats. But we also need to be ready for the threats of the future, not just for the next 3 months, but for the next 3 years and beyond. Health threats will continue to emerge, so we must build a legacy that will help us prepare for these future threats and that will help build a world-class public health system in Scotland. Today, the First Minister has announced that we will invest over £13 million next year in developing a truly world-leading Scottish whole genome sequencing service. Sequencing has already proven to be a powerful method to detect new variants of concern and to investigate links between strains and outbreaks. It helps us understand transmission better, helps us design treatments, gives us early warning of new strains, and builds a legacy for the future. Scotland's sequencing science is already world-leading. With this investment, we will build on that science to create a service that can help in our next critical stages of responding to this pandemic. A service that could sequence up to 1,000 cases per day if necessary. One that helps us deal with the risks of today and tomorrow. Presiding Officer, this service will underpin our updated approach to testing. That approach will continue to be refreshed as we adapt to the pandemic conditions facing us and seek to incorporate and deploy emerging technologies. And there are 2 core messages that we want everyone to get from publishing this updated strategy today. Firstly, look how far we've come. At the start of the pandemic, before Test and Protect was launched, Scotland had a daily testing capacity of 350 tests. By the end of this month, daily testing capacity across the entire system will be at least 250,000 tests per day. We now have 8 drive-through regional test sites, 42 mobile testing units, 33 walk-through local test sites, and 21 small-scale test sites located across the country. And I want to say a heartfelt thank you to everyone who has helped to design, develop and deliver these sites and all of our testing capacity. There are literally thousands of workers and volunteers all over Scotland involved in this shared national endeavour. And the second message is this: we all need to know when and how to get a test, and where to get a test. As we learn to live with the threat of the virus and seek to return safely to everyday activities and lives, we must keep testing and test more and in more circumstances. Put simply, testing must become part of our everyday lives, offering an important layer of protection alongside vaccination and other measures, including social distancing, self-isolating, hand-washing and face covering in the months ahead. It will help us to return to activities that have been largely restricted over the last year. It will help us increase social contact, so vital for our mental well-being and relationships. In short, testing will help us move on from the present and into the future. Thank you.
Thank you very much, Minister. I have around 20 minutes for questions. I can ask members who wish to ask a question to press the request to speak button, and if they're remote, they are in the chat function. And I call Donald Cameron to be followed by Jackie Bailey. Mr Cameron.
Thank you, Deputy Presiding Officer. Can I thank the Minister for prior sight of her statement? This week, we passed the one-year point when the UK first entered a nationwide lockdown. But on a more positive note, 26.5 million people in the UK have received their first dose of the vaccine as of today, almost half of the adult population, with nearly 2 million in Scotland receiving theirs. We must remain vigilant, however, and it's critical we continue to utilise testing as much as possible, given its crucial role in combating the virus. I welcome the various announcements made today, although they have been a long time coming. For instance, community testing was first announced in December, 3 months ago. Can I ask firstly why it's taken so long to put community testing in place? And given that the Scottish Government has access to a testing capacity of around 77,000 per day, and we've just been told that by the end of March, daily testing capacity across the entire system will be at least 250,000 tests per day, can the Minister explain why yesterday only 17,000 people were tested, showing that the Government is nowhere near making full use of existing testing capacity?
Minister.
Thank you, and I thank Donald Cameron for raising those points. I think, first of all, he mentioned capacity, the community testing and why we haven't been able to roll that out sooner. We had the first pilot for community testing in December, and of course, like any of these events that we undertake and do, I think it's really important that we evaluate the lessons from that and look to see what we could replicate from that as quickly as possible. But also, what's been really important about our targeted community testing is the fact that we've done that in conjunction with health boards and with local authorities. And as I said in my statement, we've managed to roll it out now across 20 local authority areas, which is no mean feat, given that we're now into March of this year. So that engagement has been really important in making sure that we're testing in the right places and where that's most appropriate for local circumstances. So I hope the member recognises those points and would accept that. And in relation to his second point and the utilisation of capacity, he does make an important point, and again I outlined in my statement the huge increase in capacity that we have and the capacity that we have with PCR testing and with our lateral flow devices as well. But that's where the strategy document that we've released today is so vitally important, because it outlines how we intend to use that capacity. But I would also highlight another important point as well, that it's important that we retain an element of that capacity, especially in these next few stages as we ease out of lockdown, because should there be other outbreaks and we need to utilise that, it's important that we have that resource there. So again, we've set out the plans for today as to how we intend to utilise that capacity and our plans for doing that.
Jackie Bailey.
Can I thank the Minister for an advance copy of her statement? Scottish Labour has long called for the Government to take seriously the need for more testing, and I welcome much of what the Minister has announced. The vaccine has been great news, but the experts are still clear that the virus is still going to be here for some time. So we need robust testing and tracing to find and isolate outbreaks. The Scottish Government's own COVID-19 advisory group has said it's desirable to test more people, even if that increased test positivity and that expanded testing and community testing could be a game changer. But community testing is still too small scale. Last week, less than 6,000 asymptomatic tests were carried out at community sites. They uncovered 155 positive cases. How many more are going undetected? So does the Minister accept the need to expand community testing even further and actually advertise it to local people, especially as restrictions lift? And why, after all the effort to scale up Scotland's testing capacity, is the Government content to let more than 50,000 gold standard PCR tests go unused every day as asymptomatic cases go untested. And finally, Presiding Officer, from November to January, only 30% of self-isolation support grant applications were awarded. That's woeful. And I'm worried that some will refuse tests and not self-isolate as a result. It would be very helpful for the Minister to outline what she will urgently do to rectify that problem.
Minister.
Thank you. And Jackie Baillie raises a number of really important points there. And I would say in relation to the first point about community testing and the fact that, yes, we do want more people to take part in community testing. We want to roll that out right across Scotland and make sure that we work with the local authorities, with local health boards to do that in an effective way that will work. And the advertising element of that is absolutely critical to that as well. We need people to know that community testing facilities are available in their communities and that they can access it. But that is why we've worked with local health boards in relation to communications to make sure that they're doing all they can locally, and why we're doing what we can as a government to advertise that and again encourage people to take part in community testing where that exists in their local areas. And again, we're more than happy to look at that and see what more we can do to push that message even further. Jackie Baillie also talks about, in the same way as Donald Cameron did, about the PCR capacity that we have and the fact that not all of this is being used. Now, I would say that, I mean, it's thanks to the efforts of everybody that have been sticking to the restrictions and the guidelines that we have in place, and thanks to the progress with our vaccination programme, that prevalence of the virus has been falling in recent weeks. And of course, with prevalence falling, that means that there are fewer people with symptoms isolating and booking tests, as there are fewer people who are actually ill with COVID. But again, as I said in the previous response, we know from experience that that can change, and we need that resilience in our testing system so that we can respond to that if demand increases again. And PCR testing is only one aspect of our testing programme. There's extensive lateral flow testing for people without symptoms in schools, workplaces right across the country. And we will be continuing to use all of our testing capacity as effectively as possible. And I think the last point that the member raised as well was about self-isolation. Again, that's absolutely critical in relation to all the areas that we're looking at here in terms of tackling the pandemic, alongside vaccination, our testing programme, all the non-pharmaceutical interventions like social distancing, wearing face coverings, and self-isolation is key to that as well. Now, the figures that we have about people who are self-isolating, there was a UK-wide survey done which showed that 80% of people were adhering to self-isolation advice, but we're also undertaking our own work on that to identify exactly what the situation is in Scotland. But we need to make sure that people are aware of the support that is available to them, and it's critical that we get that right. But I would say that we have got significant packages in place, and we are trying to help as many people as possible and get that message out about the support that's there as much as we possibly can.
Now, I've got 12 minutes and 10 members wanted to ask questions. That tells you how short your question, one question, and short answers. Now, please, Claire Adamson, followed by Brian Whittle.
Thank you, Presiding Officer. The virus is adapted and there are new variants of concern, and no doubt others will emerge in the coming weeks and months. May I ask, how will this genomic sequencing scheme help us detect the new variants? And as we're also seeing the use of surge testing in England, where there is community or localised outbreaks linked to the new emerging variants. This approach has not featured in today's statement.
No, that's not a short question. That's not a short question. So can we have the first bit about the genome sequencing, I think it was, please?
Okay, thank you, Presiding Officer. I would just say in response to Claire Adamson that our genomics expert advisors have advised that there isn't any scientific rationale for mass testing to try and find to eliminate the new variants of concern. And if a variant of concern is identified through whole genome sequencing, local health protection teams carry out enhanced contact tracing, and that case is reported through the 4 Nations twice-weekly variants of concern publication. And the approach that we have here, which is extending the circles of investigation and testing around that positive case of the variant of concern, that has a clearer scientific rationale than mass testing in entire geographies, and it is essentially a quicker way of controlling and containing outbreaks.
Thank you. Now, let's get short questions from now on. Mr Whittle, you set an example followed by George Adam.
Thank you, Deputy Presiding Officer. There was a breakout in Kilmarnock Prison where there was almost 200 cases of COVID, including 40 staff, and 18 of those staff were asymptomatic. So I can ask the Scottish Government why it still feels the need to assess operational feasibility and the impact on public health when the evidence is already clear.
Thank you. Minister.
Again, when it comes to testing and where we carry that out, all of our approach has been based on the best clinical advice. We take a risk-based approach to the testing that we do roll out, and we try to do that in as best a way as we possibly can, and guided by that intelligence. And that's the key to what's been laid out and set out in our strategy today as well. The approach that we want to take with our targeted community testing, working with local health boards and local authorities to see where that can best be utilised, and focusing it on areas where there is high prevalence.
Thank you, George Adam, followed by Pauline McNeill.
Thank you, Presiding Officer. I'll try to be quite quick and set an example. Listening to the Minister's statement, it appears that updated testing strategy suggests that testing will become part of everyday life. Can the Minister explain further how that will work in practice and the role she envisaged testing playing to help continue to respond and suppress the virus?
Minister.
I thank the member for that question. Test and Protect has been an absolutely critical part of our response to the pandemic right from the beginning, and it will continue to be absolutely vital as we cautiously ease out of the restrictions and move out of lockdown. Because, of course, we have to remember that the virus hasn't gone away, and everyone with symptoms should isolate and book a test as soon as possible. And extending asymptomatic testing, including through community testing, will help us find cases that might otherwise be missed. And it's finding these cases and supporting them to isolate and break chains of transmission that will really help us suppress the virus.
Pauline McNeill, followed by Stuart McMillan.
Will the Scottish Government support lateral flow testing as a way of allowing people to fly safely from our airports? Or if not, given the undercapacity of the PCR test, would the Government prefer that? Will they allow some testing at airports to save our connectivity?
Minister.
In terms of the types of testing that we use, I mean, again, as we've set out in our strategy, we've set out the rationale for the types of tests that we use and where we use those tests, whether they are PCR or whether they are lateral flow devices as well. And when it comes to opening up areas, whether that's across the economy or not, I mean, these are all factors that we take into active consideration. So these will all be things that we will be looking at and considering further.
Stuart McMillan, followed by Mark Ruskell.
Thank you, Presiding Officer. Today's news about the expansion of testing is certainly very welcome, but can I ask the Minister how the data will first of all be gathered and reported, but also how it's going to be used to inform our approach to further testing and indeed managing the virus in the future?
Minister.
I thank Stuart McMillan for that, because data on testing is absolutely vital, and that will obviously continue to be reported in the usual ways. Now, daily data on confirmed testing through PCR through our PCR testing will be published on the Scottish Government website, and data on all aspects of lateral flow testing will be published in the Public Health Scotland COVID-19 Weekly Statistics Report, and new data will be being added to that from today, which will be built upon with additional data over the period ahead. And as we set out in our strategy update today, work is also underway to continue to develop an evaluation framework for the testing strategy, which draws on routine testing data, national surveys and local evaluations, and monitoring and evaluation across the whole testing programme will essentially be used to inform our ongoing approach to testing and managing the virus into the future.
Mark Ruskell, followed by Alec Cole-Hamilton.
I welcome the extension of asymptomatic testing for early learning and childcare settings, but what's been announced today falls way short of a workplace testing strategy for Scotland. So can I ask the Minister, why is it that food businesses will receive asymptomatic tests for their staff, but those working in waste management centres or bus depots won't, despite the fact these kind of settings have seen serious outbreaks of COVID in recent months?
Minister.
As I outlined in my statement earlier, about, especially in relation to where we've rolled out testing to food production and to food distribution, there are very particular reasons for that because of the types of environments that exist there, and that is where we have seen high incidences of outbreaks, and we felt that that was the most appropriate area to look at first. We have to consider this in terms of looking at the capacity that we have and how we best utilise that and roll out workplace testing in accordance with the capacity that we have too, in accordance to our strategy. And we essentially do that on a risk-based approach so that we make sure that we are using our capacity in the most effective way and we open the economy in a sustainable way too. Now, all of these areas, these other areas that Mark Ruskell mentions, I mean, I'm more than happy to look at these. And again, as part of our targeted community testing as well, what we've been discussing with health boards and with local authorities too is, are there particular sectors in those regions that we can look at to roll out testing? So I wouldn't say that anything is particularly rolled out, but we have to go through that risk-based approach and make sure that that is effective and best use of the capacity that we have.
Alec Cole-Hamilton, followed by Emma Harper.
Thank you, Presiding Officer. We've heard several times this afternoon that we are only using a third of our daily testing capacity. Whilst I understand the government will not prioritise key workers like frontline police officers in the vaccine rollout, perhaps it can prioritise them in the testing rollout. We are testing control rooms, that's understandable, but when can we start testing these vital frontline police officers?
Minister.
Oh, thank you. The member raises a really important point there too, and that's not to say that we don't think any of these areas aren't, that testing shouldn't take place there. And that's where, as I outlined in my statement, the areas where we have rolled out testing to all the emergency services, to their call centres, we're guided by the clinical advice on this and where the most appropriate use of testing is and what type of testing that should be. But again, we continually keep that under review, and we are in constant discussion with the emergency services and with other key sectors too, as to where testing could be utilised and where that would best be done. So again, I wouldn't rule anything out and say that this is something that is constantly being monitored.
Emma Harper, followed by Edward Mountain.
I welcome the expansion of testing for workers in food processing. These workers have been critical during the pandemic. How will the Minister ensure that we reach agency or temp workers who may be reluctant to take up testing due to the potential impact of earnings if they have to self-isolate?
Minister.
Thank you. I would just elaborate on the response that I've given to Mark Ruskell in relation to the food sector, because obviously, the aim of the testing programme in that area is to contribute to the reduction of coronavirus-related risks in high-risk settings, and in doing that, enhance the resilience of critical food supply. And that will help to reduce the risk of significant impacts on businesses and their employees that can occur where there's an outbreak. Now, we are engaging directly with all companies that have expressed an interest in testing to help them understand the guidance and the practical steps that they would need to take to proceed, and to ensure that they're aware of the importance of supporting any employees that are required to self-isolate as the result of a positive test. And of course, as I said to Jackie Bailey, this includes making companies aware of the extensive package of measures that are available to support people who need that practical and financial support to self-isolate. And we recently expanded the eligibility for that too. And again, as I outlined in my statement, we've had 60 companies who've registered an interest in that, where the average employer number is around 200 people, and they're located across 26 different local authorities in Scotland.
Edward Mountain, followed by David Torrance.
Thank you, Presiding Officer. Minister, effectively testing patients attending hospitals, especially those going into accident and emergency, will reduce the need for red and green routes. Are you confident that the testing you propose is robust enough to make red and green routes redundant?
Minister.
I would say that I believe that the testing that we have in place is robust. If the member has any particular concerns that he wants to raise with me about that, then I'd be more than happy to correspond with him on that.
David Torrance.
Thank you, Presiding Officer. I welcome the expansion of testing to all emergency service control room staff. Can I ask the Minister, will this be extended to all frontline emergency service workers too?
And if you got that, Minister. Minister?
I think I've picked that up, so I'll try to respond to the member as best I can. Now, the Scottish Fire and Rescue Service and Police Scotland identified that their operational control rooms and command, control and coordination functions as being business critical for the delivery of emergency services. So asymptomatic testing of that group of staff is a vital part of business continuity to ensure that any potential cases of COVID-19 are quickly identified in those critical operations of our emergency services. And we've also implemented regular testing testing for all Scottish Ambulance Service staff as part of our rollout of healthcare worker testing. And we're actively considering expanding testing in both police and fire and rescue to other specific staff groups where other COVID mitigations, such as physical distancing or working outside, are challenging. And that includes areas like driver training and staff carrying out wellbeing assessments. And again, as I've said in previous responses, our approach is really driven by the expert clinical and scientific advice that we receive. And again, it's a situation that we continue to monitor and keep under review.
Can I thank members? We got them all in time, and I thank the Minister. I put you under a bit of pressure, but you got through it. And that's the end of the statement and questions on. It's time to move on to the next item of business.